हेलो ब्यूटीफुल पीपल, कैसे हैं आप। मैं हूं शिवानी और स्वागत करती हूं आप सबका अपने प्यारे से चैनल पे। तो आज मैं बॉर्डर मोल्डिंग करूंगी और उसके बाद फाइनल इम्प्रेशन लूँगी। तो जो भी इंटरेस्टेड है देखने में वो देख सकता है, और जो नहीं है इंटरेस्टेड तो वो ना देखे। मतलब जो डेंटिस्ट्री फील्ड के हैं वो इस वीडियो को देखेंगे, उनके लिए ये फ़ायदे में रहेगी। इस वीडियो में मैं सारे स्टेप्स और प्रोसीजर्स एक्सप्लेन करूंगी जो हमारी बॉर्डर मोल्डिंग के लिए इम्पॉर्टेंट होते हैं, जिससे अच्छे से रिटेंशन कैसे आ जाए वो सब मैं आपको इस वीडियो में बताऊंगी। अच्छा, इस टाइम पे मैं चेक कर रही थी अपनी जो कस्टम ट्रे है उसके जो बॉर्डर्स हैं, बिकॉज जो बॉर्डर्स होते हैं दे शुड बी 2 mm शॉर्ट ऑफ दिस सल्कस। तो जो भी हमारा सल्कस एरिया है, सल्कस से वो 2 mm शॉर्ट होने चाहिए। तो वो मैं चेक कर रही थी कि कहीं ज़्यादा ना हो, और पीछे पीपीएस से भी मैं चेक कर रही थी। In this video, the technique of border molding which I use is incremental or sectional border molding. And the material of choice for this kind of border molding is green stick compound. Now the green stick compound is softened over the flame and added along the borders of the compound. Make sure your custom tray should be dry. Otherwise your green stick compound should not stick to the borders of the tray. In this sectional border molding, the labial vestibule is refined first, followed by the buccal vestibule and then the posterior palatal seal area. The green stick material should be tampered with warm water before placing it intraorally. Now I am doing the passive movements. In this, the lips are first elevated and then extended outwards, downwards and inwards. C O D A. First elevated, then outward, downward and inwards. Okay? And this is for the labial vestibule. And for the buccal vestibule, cheek is elevated, then pulled outward, downwards and inwards. Buccal frenum is recorded by pulling the cheek backward and forward. And the distobuccal region is recorded by pulling the cheek again outward, downwards and inward, followed by opening the mandible wide and moving the mandible side to side. Next, the posterior part of the palate, which is the posterior palatal seal area, is recorded by asking the patient to say ah, ah, ah sound. इधर दिख रहा है, रिटेंशन ऐसी होनी चाहिए। ये सक्शन जो साउंड है ना, दिस शुड बी द रिटेंशन। ऐसी होनी चाहिए रिटेंशन। ये जो है ना, ये अभी सर्कस पे है, हमें 2 mm शॉर्ट ऑफ दी सर्कस करना है। मैं अभी इसको ट्रिम करके आपको दिखाती हूँ। Now for the secondary impression or for the wash impression, I am making holes onto the impression tray to allow the escapement of impression material. Holes should be placed in the areas of mid-palatine raphe, anterolateral and posterolateral regions of hard palate and residual ridge region. These holes prevent the tissue displacement during impression making. recording wash impression, the material of choice is zinc oxide eugenol. Now the zinc oxide eugenol is manipulated on glass slab by using cement spatula, and after manipulation the material is loaded onto the tray. Make sure to remove the excess material onto the tray, otherwise it will lead to an overextended impression. Now the patient is made to sit in an upright position and tray is placed in the patient's mouth using labial notch as a guide. The tray is seated into position by applying alternating pressures on the right and left molar region using index fingers. Passive movements similar to those performed during border molding are repeated. After the material is set, the tray is removed in a single jerk, and the impression is inspected for deficiencies and voids and is repeated if necessary. And then for mandible, the wash impression is recorded by similar procedure. And the border movements for the mandible should also be performed. Now I am removing the handle of wash impression and readjusting the wash impression inside the patient's mouth. Then I will check the size of perforated tray. Usually for dual impression, the size of perforated tray must be a size greater than the normal size. Now as this is a case of dual impression, so the second pour is of alginate, and alginate is mixed with water and is loaded onto the perforated impression tray, and then should be placed onto the wash impression which I already placed inside the patient's mouth. Now after the alginate is set, the dual impression is taken out of the mouth.